And that story is developing at the same time El Paso hits a big milestone in healthcare. A brand new hospital is taking shape over at Wrestler and Trans Mountain in northwest El Paso.
It's going to be state-of-the-art academic teaching facility. We're going to be training medical students, nursing students, physicians, advanced education, medical education. So it's a great opportunity for El Paso.
The steel structure for the latest Providence Hospital campus is already up. When it opens in 2017 as a teaching hospital, it will provide healthcare service to El Paso and give a lot more opportunities for doctors to stay in town. And because it's a new facility, the hospital will have access to extra federal funding for Providence and Texas Tech University. The overall availability of hospital beds and services in El Paso is increasing by a lot. ABC 7's Andrew J. Polk has perspective. You'll see it only on ABC 7. Andrew?
Bob and Ashley, the building behind me here still has a ways to go before it'll be ready to start accepting patients here in the Northwest. But when it is completed, it'll be just the latest part of an increasingly large amount of hospital services available in the borderland, and it's something that is expected to continue.
If you look at medicine across the region, especially in border areas, El Paso is no different than in many other border communities in the state of Texas. Tend to be very underserved from a medical standpoint as far as number of physicians.
And as the demand has been recognized in our area, expansion has been happening. Across the region, different hospital networks are boasting the largest number of employees, square footage, and space to date, with more on the way. In total, there are about 9,400 employees across the major networks, serving about 2,200 hospital beds with almost 2.5 million square feet in total.
You end up trying to figure out, how do we recruit more doctors, how do we bring in more medical providers, how do you expand nursing resources, whether it's through training programs or development.
This hospital, when it finally opens in 2017, will be just one of the latest additions to the health network here in El Paso, both based on the demand and need for services in our area and the greater supply of those able to provide those services coming from places like Texas Tech.
So with a new hospital, we're able to garner federal support for new residencies. We couldn't do it at an existing hospital, but we can do it at a new hospital. So that allows us to train more physicians. And we know that 25% of the physicians we've trained here in El Paso have stayed in El Paso to practice.
And the growth continues. For example, just within the next couple of months, University Medical Center is expecting to break ground on 2 new clinics across both sides of town. So for now, reporting live in northwest El Paso, Andrew J. Polk, ABC 7.
Andrew, thank you so much for that perspective.